Welcome back to another Auris Wellness video. Today is going to be another one of the frequently asked questions series. This is a topic that a lot of parents come to me asking about. Should I get started with some sort of expander? RPE stands for rapid palatal expander. Or should I consider some sort of myofunctional therapy? It's not really an either or situation, but sometimes you have to decide where to get started. So today I'm going to walk you through what my conversation with a lot of parents looks like on these topics. Let me first briefly clarify what each of these mean before we can compare them. So pictured on the left are some expander options. There are different types of expanders that go about the function in a little bit of a different way, each one, but generally in terms of how they achieve the movement, they're going to be acting quite similarly. So we have a dental appliance that's temporarily going to be fixed or glued in place. It's going to loop around some of the teeth in the mouth to help connect it and set it into the right position. And there's a little screw and key device that the parent has to turn at certain frequencies. And that's going to be what puts pressure on the teeth to influence some of the expansive growth force. So sometimes the growth force is only going in a side-to-side direction, while other times it will apply a force in a direction to expand in a forward direction as well. And then myofunctional therapy is a physical therapy that's focused on the muscles around the mouth. It is going to address functions like breathing, sucking, chewing, swallowing, and speech. And then it's also going to be influencing the position of the lips, the tongue, and the cheeks. So the earliest age you're typically going to find either of these treatments being offered is going to be around age 4. There will be some variability to that, but the idea here is that some degree of cooperation is required in either case to get started making the appliance or to get an active participant for therapy exercises. For patients younger than 4, I do have an older YouTube video that I'll link below that includes some suggestions for what you can do now rather than just waiting until your child is 4 to get started. It can sometimes be quite difficult to find a provider who sees patients as young as 4 years old. Historically, orthodontists were not taught to treat patients that young. So that is part of what I offer with my consulting services. If you're having trouble finding a provider near you, definitely reach out and connect with me. I'll see how I can help. So in either case, there really is no upper age limit, but there are some things to keep in mind for a patient as they get older. When you do an expander or you do myo in a younger child who's still naturally growing, the impact on facial growth can be more dramatic in a good way. In an adult, you can influence the positioning with myo, so you can still get better breathing and better posture can be worked on at any age, but the growth of the jaws is going to be limited. Teeth can still move a bit at any age for either type of treatment. And then with the expanders, sometimes there's going to be certain kind of minor bone surgeries that's required in an adult to get better outcome to take place, or earlier I had mentioned that the appliance loops onto some of the teeth. Sometimes in adults you have to actually place temporary dental implants into the bone and attach an appliance to those implants. So it does get a little bit complicated as you get older. My advice is always the earlier the better, but it's never too late to get started. And then now I'm just going to walk you through probably some of the biggest points of comparison in just a side-by-side. So an expander is going to require more provider time. As a parent, you have to bring your child to the appointment and turn the key to activate the expansion, but it's pretty hands-off relatively for a parent. Comparatively, myofunctional therapy is going to require a parent to often do the activities with the child or oversee that the activities are being done by your child between their regular appointments with their provider. So it's definitely more active parent involvement in that way. With myofunctional therapy, you're eliciting change by building strength, tone, better habits by using the natural forces created in our own bodies. In the photo on the right, the teeth are in kind of a square shape there, you can see, and that's because of how the tongue sits back in that patient's mouth. So with something like therapy, you're going to actually train the tongue to sit in a more forward position where it should be. And then as a result, the tooth position will adapt to the forces there and ideally become more of a curve over time. I do have a YouTube video on arch forms if you're interested, if this is a curious topic and you want to know more. On the other hand, with an expander, the parent, by turning the key, is the one who's actually applying the force. So it's an external force. It's a bit less natural, but it can be really needed for a child who hasn't quite seen their own body accomplish the natural growth that they were intended to in the first place. So in this photo, you can see the green line shows the space where that expander appliance has already opened up a significant amount of space. And then, so just something to keep in mind for that reason, comparing these two kind of forces, that's why sometimes it can be recommended to work with an osteopath or do some sort of cranial sacral therapy to make sure that the forces being applied is not creating any unwanted effects in other parts of the body outside of the mouth. Not a requirement, just a potential consideration. And then the time frame can vary greatly for the total treatment time. That being said, so a rapid palatal expander, rapid is in the title because it's typically accomplished pretty quickly within a few months of treatment. And then since myofunctional therapy requires a great amount of compliance, it is basically building new habits. And I think we can all agree that new habits, committing to them is hard work. And it can often be over a year of treatment. So just keep in mind that when I'm comparing these side by side, it is just these two treatments. Often these treatments are paired with other types of situations, like you might do either one of these and then follow up with braces. So when I'm talking total treatment time, I'm just comparing an expander versus myofunctional therapy. And that brings us to our next point. So the expander is treating anatomy first with functional benefits as a secondary result. What do I mean by that? So you're going to go through the expander, you're going to have a wider palate, wider roof of the mouth, wider floor of the nose, and therefore less resistance to nasal breathing. But where's the tongue? What are the lips doing? It's kind of the same consideration when a child gets tonsil surgery. By removing the tonsils, you can change the physical landscape, but if a child is still mouth breathing and hasn't retrained a better habit to close the lips, then that habit's not going to automatically be resolved. With myofunctional therapy, the goal is to treat the function first, and then as a result, improvements of the teeth or face posture are able to take place because the functions and habits have improved. So this can be more of a comprehensive approach with kind of better long-term stability in a way, or at least stability that's more natural to maintain. Think about all the people who had braces and then stopped wearing their retainers. That's because braces are addressing the structure, but not the function. So it can be kind of the same idea, and that's why ideally we'd like to address both structure and function. And that's where sometimes we're really left with a difficult decision of where does this really get started? What's the best way forward? And ultimately, you have to decide what's right for you and your family. I'm going to walk you through a few scenarios to consider where one solution might be kind of more tempting than another, because sometimes resources are limited and you do have to choose one place to get started. Just keep in mind that sometimes both types of treatment together can be a more impactful or get you a better outcome. So this blue box in the middle here, these are some of the symptoms that could probably go either way in terms of seeing benefits from either type of treatment. So if your child is mouth breathing, if you're noticing enlarged tonsils, snoring, poor restless sleep, if your child is sick often, or you're dealing with some moodiness or tantrums. On the left in yellow are perhaps some of the symptoms of poor breathing Well, you might want to start with a more rapid solution first. So if you're seeing problems with bedwetting, if you're hearing your child gasp or stop breathing, sometimes, not always, a child might have some experience in bedtime resistance, because if they're going to bed and their body knows that they don't breathe well at night while they're sleeping, then that can be scary. Their body kind of cautions them against going to sleep, because it can almost be like you're drowning at night in your sleep. So that can be part of what's at play there. Extreme behavior concerns, crossbite. We're going to look at some dental considerations here in just a second, so we'll come back to that. And then on the right in this pink box, these are some of the situations that might tip us more towards pursuing myofunctional therapy first. So gag reflex is typically going to benefit from some sort of desensitization activity. Picky eating, increased risk of ear infections is commonly found in children who don't swallow correctly. Excessive drooling, we might need some exercises to be able to train the lips to stay closed. Thumb and pacifier habits are about spot on for some of the biggest reasons to work with a myofunctional therapist. And then open bite. So I said we were going to look at some more teeth considerations, so let's just jump in and do that now. So this photo at first glance, you might not even see that there's kind of a dental problem going on, but what's happening here is that these are all baby teeth. Our baby teeth are smaller than the adult teeth that will eventually replace them. So when we look at a child's smile when they have baby teeth in, we should be seeing spaces between them. When their baby teeth line up kind of nicely like this and there's no spacing there, that really means that they're crowded and the jaws aren't growing with quite enough space that we would like to see, meaning that as the adult teeth come in, the adult teeth are definitely going to be crowded. So in a situation like this, in a patient like this, I would be curious to know more about the symptoms the patient is having to decide which direction of treatment is most appropriate. They could probably go in either direction here. And then this second photo demonstrates what we call an anterior crossbite. So the top teeth ideally should be sitting in front of the bottom teeth, but in this situation, they got trapped in a poor growth pattern. This is probably a situation where an orthodontic appliance is going to be needed. It's going to be hard with therapy alone to get those teeth to shift and switch positions. And then this third photo shows us two things. One is a posterior crossbite, which is what the arrow is trying to point to. Look at how narrow and squished those top teeth look. So in this case, we have the back teeth positioned poorly in that we want the top teeth to sit closer to the cheeks rather than to the tongue. This scenario might be about as close as what an expander was designed to address. However, this patient also has an anterior open bite in the front. So that dark space between the top and bottom teeth in the front, we want to get to the bottom of why that happened. In the case of a child with a thumb habit, for example, sometimes the teeth have to grow around the fact that a thumb is constantly in the mouth. Or sometimes how a child might swallow, their tongue might kind of jump in and fill that space when they swallow, and that can be repeated multiple times a day, and that can kind of push the teeth open. So now you get a little bit of an idea why it's not always clear what the right path forward is. It can be complex, and all of that's without even taking into consideration what you as the parent prefer to do and what you think your child is more likely to tolerate better. So this video was, again, only comparing two solutions because it's very common that parents come to me asking about these two options. You need to make sure you understand there are, of course, more than two treatments. I'm not going to go into all of that right now, but I am getting ready to release an online course that I'm excited to share with you that's going to walk you through an overview of different kinds of providers that can help, different types of treatments that exist. So make sure you subscribe to my newsletter, and that way you can stay updated on the course launch as it rolls out. Thank you so much for watching this video and listening to what I have to say. I hope you found it helpful, and I hope to have more information coming your way soon. Thanks. Take care.